The Wake Up Call with Ian Collins and Anna Cookson.
BBC Radio Kent.
Meanwhile, at the conference, something we weren't expecting. A surprise announcement. Boris Johnson indicating that Canterbury could be getting a new hospital. It was a fringe event, so not one of the main bits, which is why when you listen to this, it's a little bit hard to make it out. But I think you can hear what Boris Johnson's saying.
And yes, we're going to invest in the southeast of England. And yes, of course, we're putting money into hospitals. I'm delighted that Canterbury, for instance, is going to be one of the 40 new hospitals we're building in the biggest programme of hospital infrastructure investment for a generation.
So you definitely hear the word Canterbury there very clearly among everything else. He is indicating that Canterbury will be getting a new hospital. We spoke to Mark Norman, our health correspondent, about this earlier.
Nobody had any idea, is the brutal truth yesterday, that this was going to be said. Nobody had a response for us or all the other journalists who would have been contacting them. And we were referred to the department, who equally did not have an instant response. Often they have statements available for us, readily written beforehand. That wasn't the case yesterday. And they've really caveated their language in what they did send us, so they've not issued a flat-out denial, but clearly it's not on the list of 34 new hospitals.
Karen Constantine is a Labour County Councillor, District Councillor as well in Thanet. Karen, thank you for joining us this morning. What do you make to this news?
Well, I frankly think this is more Boris bluff and bluster. I've been following this overnight very carefully, close detail. There's no sign of any money coming through for a hospital in Canterbury. This is Boris Johnson using the NHS as a political plaything. This is unsubstantiated promises to please his audience at the Tory party conference. The NHS needs genuine investment and it needs it now, and this isn't the way to do it.
When we phoned the Department of Health, they said if the Prime Minister has said it, it must be accurate. So if they're saying it's accurate, then we can suppose it is, can't we, Karen?
I don't think we can. I don't think there is any money coming through for Canterbury. I don't think the Department for Health and Social Care have confirmed what Boris Johnson said, and I think he's in a bit of a hole about this. But on the other hand, what we are hearing is the huge need for greater investment, and particularly a sort of rapid expansion in workforce for the NHS. Indeed, you've got the Royal College of Nursing advising the government that the staffing issue inside the NHS is at a tipping point. So instead of playing games with people, I think what the government really needs to do and what Boris really needs to focus on is what is actually happening inside the NHS, which is a really huge workforce crisis. And what I said yesterday was, even if we could build spanking new buildings in every location, we simply would not have the clinical staff to put in those buildings, and that is what this government needs to deal with first and foremost.
We're sketchy on the details, so we don't know that funding wouldn't be forthcoming for the staffing, but you're absolutely right. That needs to be part and parcel. But what about the idea of it, the idea of a new hospital in Canterbury, Karen? Do you think that should happen?
Well, again, I can have full sympathy with the people of Canterbury with their hospital, which is in genuine need of much more than a facelift. And it's in a very poor state, really. But the point here is we need to invest in what we've got, and we need to invest in our workforce so we've got the doctors and nurses and midwives that we actually need. And what we don't want to see is a hospital popping up in Canterbury at a cost to the people of either Ashford, who could lose out, or Thanet, who could lose out, and that would be the worry. And I can tell you, I hear the horror stories every single day about what's going on in our NHS. People that can't get on a doctor's waiting list, people that can't get to see a doctor, people that need scans urgently that are now waiting 3 weeks or travelling across from Thanet to Ashford. I mean, this is absolute chaos. So we don't need half-baked promises for new hospitals. We need actual concrete action. And we need this government to wake up and actually listen to the health professionals and the population who are clearly telling them what is going wrong. This just won't do. This is just more Boris bluff and bluster. And he's playing Monopoly with people's lives.
We have plans on the table, don't we, Karen, for Kent at the moment? Nothing's been decided, but there are different options. What would Labour do with the hospital situation?
The first thing that we would do is we would secure a massive investment of £30 billion into the NHS, which we have fully costed. The second thing that we would do is we would restore the nursery for nurses and midwives to make sure we've got the throughput of people coming in that want to be those great NHS professionals. And we'd also incentivise doctors to stay in the NHS by introducing more genuine flexible working, better terms and conditions. We'd scrap the pay cap so that we could reward our workers properly, which anybody using the NHS wants to see the staff being paid properly. And we know in the lower grades that is simply not happening. We know that we're seeing sometimes nurses and midwives using food banks. Now, that cannot be right. So we need to urgently fix that problem. And I think one thing we've got to do is we've got to stop raising false alarms, and we've got to stop going through restructures which actually just exhaust people and end up in fatigue and confusion for the general population. That just isn't on anymore.
OK, Karen, thank you for your time this morning. That's Karen Constantine, the Labour County Councillor and District Councillor in Thanet as well.